Good afternoon to everyone, and welcome to WHO press conference on global health issues. My name is Tariq, and I welcome you and thank you for joining us today. As always, we have a number of WHO experts here with us in the room or online who will be answering your questions. So I will start by introducing who is here in the room, and will later also say who is online with us. So obviously Dr. Tedros, WHO Director General. Next to him is Dr. Maria Van-Kerkhove. She is Interim Director of WHO's Department of Epidemic and Pandemic Management. With us is also Dr. Stuart Keel, who is the technical lead of WHO for eye care. Also, we have Ms. Sigrid Kranavetter, who is Director of WHO Governing Bodies. With us, especially today, is our representative in Sudan, Dr. Shibil Sahbani. And we also have with us Mr. Derek Walton, WHO Legal Counsel. In the room, and who is not on a podium, we have Teresa Zakaria. She is Unit Head for Risk Reduction. We have Dr. Deus Mubangizi, who is Director, Medicines and Health Products Policies and Standards Department in WHO. And we also have Dr. Kate O'Brien, that you know very well, our Director for Immunization, Vaccines and Biologicals. We have a number of others online, and we will introduce them as need be. With this, I will give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. First, one issue that WHO works on that doesn't often make the headlines is eye health. Cataract is the most common cause of blindness globally and the leading cause of vision impairment, affecting more than 94 million people. In addition to impaired vision and blindness, cataract can contribute to reduced mobility, unemployment, social isolation, depression, and anxiety. Cataract is a major public health problem with a simple, cost-effective solution, and it can be resolved with a 15-minute procedure, providing immediate and lasting restoration of sight. Cataract surgery is life-transforming, giving the gift of sight to people who had lost it, and reopening a world that had closed. In 2021, the World Health Assembly adopted a global target to increase access to effective cataract surgery by 30 percentage points by 2030. Many countries have made impressive progress, including Bhutan, Cambodia, Nepal, and Qatar. But globally, half of all people who need cataract surgery still don't have access to it, according to new research involving WHO published today in the Lancet Global Health. In Africa, 3 in 4 people with cataract lack access, and in all regions, women are disproportionately affected. The research estimates that coverage will increase by 8.4 percentage points by 2030, less than 1/3 of the pace needed to reach the 2030 target. WHO urges governments, partners, and donors to invest in this cost-effective and life-changing intervention to prevent blindness and give people back the gift of sight. The new research published today was led by the International Center for Eye Health at the London School of Hygiene and Tropical Medicine, which is in the process of becoming a WHO collaborating center. It's an example of the valuable contribution that WHO's network of over 800 collaborating centers can make to research and global health. Now, some good news on cholera. In 2013, WHO and the coalition of partners established a stockpile of cholera vaccines for 2 purposes: to conduct reactive vaccination campaigns in response to outbreaks and preventative campaigns in areas at risk of outbreaks to stop them before they happen. Since 2021, the world has experienced a significant increase in cholera outbreaks, cases, and deaths. Last year alone, more than 600,000 cases and 7,600 deaths were reported from 33 countries. This increase put heavy demand on the stockpile, which meant that preventive campaigns had to be stopped to ensure enough vaccines were available for reactive campaigns. Following sustained efforts by manufacturers and partners, the annual global supply of oral cholera vaccine has now doubled from 35 million doses in 2022 to nearly 70 million doses in 2025. Thanks to this increase, we have now been able to resume preventative vaccination campaigns against cholera after more than 3 years. This is important because it could help us to turn the tide on cholera, preventing outbreaks instead of only responding when they happen. Last week, Mozambique became the first country to resume preventive vaccination, reaching 1.7 million people at risk of cholera, including in remote areas. In parallel, Mozambique is also conducting reactive campaigns to control an outbreak that has been fueled by recent floods. Preventive vaccination campaigns are also due to start in Bangladesh and the Democratic Republic of the Congo. We thank EU Biologics, based in the Republic of Korea, which is currently the only manufacturer producing cholera vaccines at the scale needed for mass vaccination campaigns. While vaccines are an important tool, the best investment in preventing cholera is in safe water and sanitation. Cholera is one of many examples of diseases that can be easily prevented with vaccines. Since 2000, under-5 mortality has dropped by more than half, thanks largely to the power of vaccines. Today, WHO's Regional Office for Europe published new data with encouraging news. The number of measles cases in the region dropped by 75% last year compared with 2024. This is due to increased vaccine coverage, community outreach, outbreak response, and more. At the same time, 5 countries in the European region lost their measles elimination status in 2024. Misunderstanding and confusion about the safety of vaccines are fueling outbreaks and costing lives in many countries. We must listen carefully to people who have real concerns and give them the information they need to make the best decisions. At the same time, we must keep saying it. Vaccines work, vaccines are safe, vaccines save lives. One rare but deadly disease for which we do not yet have a vaccine is Nipah virus. In the past few weeks, 3 cases of Nipah, 2 in India and 1 in Bangladesh, made headlines and caused concern about a wider outbreak. Over 230 contacts have been followed, but no further cases have been identified. The 2 outbreaks are not related, although both occurred along the India-Bangladesh border and share some of the same ecological and cultural conditions, as well as populations of the species of fruit bat that are known to be the natural reservoir of Nipah virus. WHO is working with India and Bangladesh on risk assessment, follow-up of contacts, risk communication, and community engagement. WHO assesses the risk of spread of Nipah virus regionally and globally as low. In Sudan, a situation that's already awful continues to deteriorate. Last week, the International Phase Classification published a new alert saying that famine indicators are worsening in the most vulnerable areas of Sudan. The latest IPC alert shows that 2 new areas in North Darfur have surpassed thresholds for acute malnutrition, one of 3 key metrics to confirm famine. Famine conditions were confirmed in 2 other cities in November last year. And we know that where hunger goes, disease follows. Without sustained humanitarian access, the situation will continue to spiral, threatening the lives of millions. An estimated 4.2 million cases of acute malnutrition are expected across Sudan in 2026, including more than 800,000 cases of severe acute malnutrition, making a 14% increase from 2025. Meanwhile, just when the population needs health care the most, it continues to come under attack. Since the start of the conflict, WHO has verified 205 attacks on healthcare, leading to 1,924 deaths and 529 injuries. Sorry. Today, we're honored to have our country representative with us, Dr. Shibal Sahbani, who can say more about the situation on the ground and WHO's response. Finally, last week, WHO's Executive Board held the first of its own regular meetings for the year. First of its 2 regular meetings for the year. Among the issues it decided was tasking WHO with convening discussions about reforming the global health architecture, and we're now starting that process. It's vital that all of us in global health work together to leverage our comparative advantage, avoid overlaps and duplication, and deliver value and results for the countries and people we serve. The board also considered proposals for reforming the governance of WHO and the notification of withdrawal from WHO of Argentina and the United States of America, which the World Health Assembly will consider at its meeting in May. Tariq, back to you.
Thank you very much, Dr. Tedros, for these opening remarks. Just to mention that we have also with us in the room Dr. Jeremy Farrar, Assistant Director General, Health Promotion and Disease Prevention and Control. As I said, we have other colleagues online that will be asked to answer questions if needed. Journalists who are online, please click raise hand icon if you want to be put in the queue. So with this, we will start with questions. And first questions goes to Laurent Sierra from the Swiss News Agency. Laurent, please go ahead.
Yeah, thank you, Tariq, for the press conference. Question on the US, because we could see that some municipalities and some US states started to engage with the Goarn. So the first quick question would be how many of them, as far as we speak, have requested to join the Goarn? And the second question would be, could it be the start of a kind of advisory body for cities to engage more with WHO? Because we could see with the Forum of Mayors that there is an appetite for local authorities to participate more in the decision-making of international organizations. So I assume WHO will remain a member state organization, but could it be the start of something new with the local authorities? Thank you.
Sierra, Laurent, thank you very much. The line was really not good. I understand the first question was about Goarn. I'm not sure that I understood the second question. I hope my colleagues did. Otherwise, we will ask to repeat, but maybe Dr. Van Kerkhove can start on Goarn.
Yeah, thank you very much for the question. So Goarn is our global outbreak alert and response network. It has more than 360 members worldwide. And indeed, there have been some states in the US, the Departments of Health in some states in the US that have applied to become part of Goarn. We welcome this. We welcome anyone who wants to be part of Goarn to see our website and fill in the application. It's an incredible network of national, subnational institutions, academic organizations that meet regularly, share information, information. They sometimes are deployed to outbreaks around the world, and this is a good thing. So this is an asset of WHO. It's an asset to the world, and we welcome any applications from any states' departments of health from the US and abroad.
Thank you very much. Laurent, if you're online, if you could just repeat the second question, please.
Sure. Maybe it was a problem with the volume of, is it better now?
It is better now.
Okay, sorry about that. Now, the second question would be, so could it be the start of a new advisory body with cities, with local authorities? Because we can see that local authorities have more and more appetite to participate in the decision-making within the international organization. So even if WHO will remain a member state organization, could there be a new framework with cities to tackle that small trend where states start to request a withdrawal from the organization? Thank you.
Thank you, Laurent. I think we understood it's about possibilities of local authorities getting more involved. So maybe our legal counsel can say a few words.
Well, thank you. Yes, and good evening, good day to everybody. WHO is, of course, a member state organization, but many of our activities involve actors that are not states or elements of states. I think the questions about what will happen once, following withdrawal of member states and what would be the consequences of that would be something that our governing bodies would need to consider and address. The whole question of the notifications of withdrawal of 2 member states is before the Health Assembly, who will be considering this at its meeting in May. And I think some of the implications of that for WHO's work will need to be considered as part of that process of considering the implications. So it's an interesting idea. It's something that I think will need to be considered further.
Yeah, and just to supplement that, to say that Goarn it's a technical network. We have national representatives, we have subnational representatives, and the people who are part of Goarn represent institutions that have public health experience, field experience, and their sharing of information. It's really quite an incredible network that's out there. It's been in operation for more than 20 years. So it isn't anything that's actually new, but local participation of this, if they're departments of health, ministries of health, or actors or groups that are actually participating in outbreak response or preparedness, this is a good thing. And we actually have many members who are at subnational levels as part of Goarn. As I said, there's more than 360 members currently part of the Goarn network.
Thank you, Dr. Van Kerkhove, and thank you, Derek. We go to the next question. We have Helen Branswell from Stats. Helen.
Hi, Tarek. Thank you for taking my question, and thank you for doing this press conference. I wanted to ask if WHO has learned anything more about the proposed hepatitis B birth dose that the Bandem Health Project is proposing to conduct in Guinea-Bissau. Thank you.
Thank you very much. I will ask Dr. Kate O'Brien if she could take that.
Thanks so much, Helen, for the question. We are, of course, from a policy perspective, very interested in the study. And from a scientific perspective, ethics perspective, all of the elements of any study that's done on vaccines that involves human subjects. We have been reaching out to the investigators who are expecting to conduct this study. So we are in direct communication with them to understand more about what they're planning to do and to inquire about some of the aspects of the study that are particularly troublesome and particularly of concern to a large number of people in the vaccine world. So we don't have any formal updates about any changes to the protocol, but we can certainly say that we are involved in discussions And most importantly is that there's support to the ministry, because it's ultimately up to countries to decide what kind of research happens in the country. Is the research relevant for their policy questions? And is the research being conducted according to the international standards that need to be met whenever there are people involved in research? And that has to be conducted in line with and in accordance with the ethical principles that have been established for the conduct of research. So I think these are important questions, and it's certainly an important study that requires a careful look at what the study is planning to do, what the purpose of the study is, and whether it has been designed in a way that can even answer questions that may be relevant to vaccines. So above all is the safety, the ethics of the study, and the assurance that any study that is designed is putting the interests of the participants of the study at the very top of the list of how a study is designed and whether the question is a relevant policy question.
Thank you very much, Dr. Brandes. We go to next question. We have Robin Millar from Agence France Presse. Robin, please.
Thank you. This is on the United States and COVID-19. Last year, after the SAGO report on the origins of COVID was published, the WHO called for countries with intelligence reports on the pandemic's origins to come forward with that information. And with the United States now having walked out the exit door, did they actually do that before leaving? Did they come forward and share any intelligence that they might have been holding back on the origins of COVID-19 before leaving? Thank you.
Thank you, Robin. Dr. Van Kerkhove.
Yeah, thanks very much. So yeah, we have, as you mentioned, SAGO put out its report last year on the findings of available evidence related to the origins of COVID-19. We continue to follow up with all governments that have said that they have intelligence reports, in the US included. We don't have those reports to date. We do have reports that are online, but we don't have any of the intelligence reports that have not been released publicly. So it is something that we have followed up, but we don't have access to those.
Yeah, as you have rightly said, there's some governments who, of course, through the media, said that they have intelligence about the origins, and especially to the US. After we heard about it, we wrote to senior officials to share any intelligence information that they have. But so far we haven't received, this is actually months ago, so we haven't received any information, and hope they will share, because we haven't still concluded the COVID origins, and knowing what happened with the COVID helps, because knowing what happened could help us to prevent the next one. So thank you for asking this question. I'd like actually to use this opportunity to ask any government who has any intelligence to share with us, so we'll be able to conclude the COVID origins. Thank you.
Thank you. Next question, Gabrielle Emmanuel from NPR. Gabrielle.
Hi, thank you so much for doing this as always. I had two really quick questions. One was just a follow-up on the thing that was just said about Goarn and some US states joining. One question that's been raised here in the US has been about whether Taiwan has sought to be part of Goarn, and I don't see it on the list. And the question has been whether there's kind of been pressure from China and uneven treatment of different member states. So I wanted to ask that question since I've heard people mentioning it here in the US. The other question, completely unrelated, and the primary question, is I want to understand a bit more about the funding cuts that we've seen to gender-based violence programs to combat gender-based violence, and what that impact's been, and whether there's been kind of any effort to prevent those cuts from really hurting those programs. Thanks so much.
Thank you very much. I'm just checking if we have Dr. Abdurrahman Mahmoud online to take this one. Abdi, are you with us?
Hi, Tariq. Yes, I'm online. Can you hear me?
So, yes, we can hear you. Can you please maybe take the first question regarding Goarn?
Yeah. No, as Maria said, Goarn is an informal network based on transparency and collaborations. We have network from every institutions across the world, at the national, subnational, from Hong Kong to Guangdong to China CBCs. There's nothing specific, or we don't receive any pressure from anybody. It's an open forum. Anyone that has a public health function that can contribute to the alert and response network is an open forum. Of course, there's a due process that we do go through, the non-profit status, the commitment to public health, and ability to respond to public health requests. So we issue a request for assistance, and then members of Goarn are expected to go to the field and support. And US CDC has been one of the leading part of the steering committee. So it's an open forum, all people committed solidarity and equity for global health and collaborations. So there's no restriction on membership or any pressure from any member state. It's not a member state, as Derek said, the WHO has its format. And there are multiple networks that we manage. Goarn is one of them. There are network for preparedness, network for a lot of networks being managed by WHO. And Goarn is one of those networks, but one of the oldest. We just celebrated last year, it is 25th year. Thank you.
Thank you, Dr. Mahmoud. On the second question, that was on a CATS sexual-based violence program. Maybe Teresa can speak, particularly in humanitarian settings, as it's her area of work.
Thank you very much, Tarek. Yes, I will provide a partial answer that really looks at gender-based violence, sexual violence in humanitarian settings, context. So 70% of women in crisis are subjected to gender-based violence. These are the statistics that are available to us, and it represents an enormous number of women and children, but also more and more boys and men as well being subjected to sexual violence. Now, going to the impact of funding cuts, what we have documented so far is that over 60% of organizations who in the past have provided clinical care, but also social protection, social assistance to survivors of sexual violence have had to scale back or stop services because of these funding cuts. Humanitarian aid cuts to the gender-based violence sector amounts to over $110 million US. This was in 2025. What this represents is that 3 million people, women, mostly women and girls, but also boys and men in humanitarian crisis are now deprived of access to services. We are expecting that, unfortunately, because no significant improvement in humanitarian financing is foreseen this year, that the situation is only going to become much worse. We're also seeing more and more health facilities having to suspend operations because of limited funding, and this affects those who require clinical care, healthcare in general, for survivors of gender-based violence, sexual violence, as well as broader population. Thank you.
Thank you very much. We'll go to next question. Anadolu News Agency. We have Mohammed Arslan with us. Mohammed.
Tariq, thank you so much for this briefing. My question will be about the Gaza. As you know, Rafah crossing reopened almost 10 days ago, 2nd of February. My question is, how many patients you have evacuated through this crossing so far? And could WHO bring any medical aid trucks to Gaza again through this border? Thank you.
Thank you. I guess we will ask again, Teresa, if you can take that one.
Thank you. A very important question. I think we very much welcome the opening of the Rafah border crossing, which had allowed over 90 patients already being evacuated. This then adds to the some 11,000 people who have been evacuated out of Gaza to multiple countries for very urgent and critical medical care. So we welcome this development very much, but we are aiming for more daily medical evacuations to take place in the coming days. We do know that there are over 18,000 patients, many of them who have died waiting for medical evacuations. They are still waiting for this desperate health assistance in order to survive. The opening of the border crossing, we're also hoping that it would allow much needed humanitarian assistance to be able to come into Gaza, which at this stage is still very insufficient considering the level of needs and also because of additional meteorological weather conditions. And we have all seen as well that the living conditions of people inside Gaza remain extremely dire. Health risk remains very present and abundantly. And so what we have at the moment is largely insufficient to meet the needs there are and to really bring back the dignity to the people of Gaza. Thank you.
Thank you very much. I understand we also have our colleague Nabil online. Maybe Nabil would like to add something.
Yeah, thank you. Thank you, Tariq. No, of course, in addition to what Teresa said, of course, the priority is as well to really allow unhindered humanitarian aid to really enter Gaza, and that would really help in contributing to restoring and the rehabilitation of the health system, and that would also eventually help in reducing reliance on medical evacuations. But we continue also to call for a reopening of the referral pathway to East Jerusalem and the West Bank, as it was the case before October 2023. But as for now, as for also the Rafah border crossing, we haven't. So this is really partial opening, and we are not able to get humanitarian supplies and health supplies and medicines through the Rafah border crossing. So this is still not possible. Thank you.
Thank you, Nabil. That was Nabil Tabal. He is Incident Manager, Health Emergency Program. And just to give a title of our colleague, Dr. Abdirrahman Mahamoud, who just talked about the Goarn, he is Director of Health Emergency Alert and Response Operations. Next question goes to Lancet, and we have Paul Adepoju. Paul?
Thank you very much. Can you hear me loud and clear?
Yes, we can.
Yes, so my first question has to do with post-MPOS declaration responses. So I'd like to know whether there has been any development in terms of support, in terms of update and insights regarding MPOX outbreak, especially on the African continent. And the second question has to do with...
Paul, can you just please repeat slowly your first question?
Okay,
We understand it's on MPOX, but we didn't get the detail.
So following the end of the global emergency declaration for MPOX, I'd like to know, even though we still have some countries that are now have reported new cases, new countries that have been added to the list, especially in Africa. So what has been the post-global declaration response so far? And the second question is on WHO's perception of the individual deals that the US government is announcing with respective African countries, which is different from what used to be the an African approach. How do we see these in integrating everything together to have a cohesive response on the African continent in terms of health response. So thank you very much.
Thank you very much. We'll start with Dr. Van Kerkhove on Mpox.
Yeah, thanks very much for the question, and thanks for mentioning Mpox. So yes, as you know, the Director General lifted the public health emergency of international concern, but the work still continues, and Mpox still poses a risk in many countries across the African continent. WHO is supporting on a number of different fronts, continuing to increase surveillance activities so we know where cases are and can provide clinical support for them, integrating that support through HIV care, for example. There's a lot of work that's ongoing related to risk communication, community engagement to prevent onward spread between individuals of Mpox, whether this is between families or whether it's through sexual contact and sexual networks. There's a number of efforts that are underway related to vaccination. So during the FAKE, there was an access and allocation mechanism that was established to support the donations that came in of Mpox vaccines to support the countries in need. And millions of vaccines have been made available on the African continent. And we continue to support those countries in using those vaccines in a targeted way, focusing on the most at-risk people. But I really do appreciate the question because it may not be in the headlines anymore, but the work really continues. And there are so many countries that are dealing with Mpox as part of their routine work. And many of these countries have multiple outbreaks, multiple infectious diseases that they are dealing with. So we will continue to support them. We continue to ask for financing to support that. We work with many partners, including Africa CDC, UNICEF, and others. I shouldn't start naming some because I will forget, but we work with many, WHO always works with many partners on the ground. We continue to ask for research to better understand Mpox, the clinical manifestations, the care that is necessary to understand how it transmits, the reservoir of this virus. So a lot that's ongoing. And we will continue to support all countries for Mpox.
Thank you. I understand the second question was about United States making deals with the countries in Africa. I know that Dr. Tedros has previously commented on that issue. I don't know if you, Dr. Tedros, would like to. Yeah. So I think what Dr. Tedros said last time was that well, countries are making deals and that they are sovereign countries and they can do deals in the best interest of those countries who are doing the deals. Let's move to next question. We have Health Policy Watch. And that's Kerry Cullinan. Kerry?
Okay, thanks so much. I think the DG mentioned that you have your country representative from Sudan here, and I wondered whether they could just give us an indication of what it is like day by day in Sudan, what are the most pressing issues that they are facing, and what are the needs that particularly resources that they are short of in Sudan. Thank you.
Thank you. Dr. Sahabani.
Okay, thank you very much for the question. So it's a very broad question, and I think we need hours to discuss about the health situation in Sudan, but just very briefly. Let me put the context first. The Sudan went through a war for almost 3 years now. During this war, there were attacks on healthcare. So we've recorded, as Dr. Tedros said, 205 attacks on healthcare, leading to 1,924 deaths among patients, their families, health workers, and also the community health workers. In addition to this, there is limitation of access of the patients to the services, but also access of humanitarians to certain localities to provide services, to distribute supplies, and so on and so forth, and also to do surveillance of the outbreaks. In such contexts, there are a lot of health needs. Let me start first with the outbreaks. There are so many outbreaks ongoing at the same time, and in most of the states, we have more than 3 concomitant outbreaks. Here I'm talking about cholera, talking about malaria, talking dengue fever, measles, and so on and so forth. If I give you a few figures, cholera, we've recorded until now more than 124,000 cases, leading to more than 3,500 deaths. With regards to malaria, 2.9 million cases. With regards to dengue, over 63,000 cases. This is just to say that outbreaks are a big concern for a country which is facing a war, but also facing a shortage of drinkable water in many places, lack of hygiene, wash in general, water, hygiene, sanitation, and health conditions are very bad in many states. In addition to the outbreaks, of course, there is malnutrition. And we've talked about the new IPC alert, and acute malnutrition continues to deteriorate in 2026, unfortunately. So with nearly 4.2 million estimated cases, comparing to 3.7 million in 2025. And of course, lack of access to food, to livelihoods, and so on, it will worsen even the situation, as I said. But of course, there are other needs, and here I'm talking about non-communicable diseases, including diabetes, hypertension, renal dialysis, and so on and so forth. And don't forget, I think one of our colleagues mentioned the gender-based violence. If I put it also in the context of sexual reproductive health in general, access to safe care for emergency obstetric care, access to clinical management of rape, and so on, all those constitute a big challenge in the context of Sudan.
Thank you very much, Dr. Sahbani. I see we have another journalist from NPR. We have Jonathan Lambert. So, Jonathan, please go ahead.
Hi, thanks so much for taking my question. I have a couple of questions about the influenza vaccine meeting coming up soon, later this month. I know that last year there was a reduction in the number of samples sent from national influenza centers to WHO collaborating centers, in part because of funding cuts. Are those sample submissions still down? And if so, by how much? And then my second question is whether WHO knows if the US will be participating in the flu meeting. Thank you.
Thank you, Jonathan. Dr. Van Kerkhove?
Yeah, thanks. Hello, Jonathan. I think we were communicating on this a little while ago. So yes, there was, as we had talked about previously, there was a slight dip in the circulation of influenza vaccines around the world because of a challenge with some funding. But we have been able to resume the shipments around the world. As you know, the GISRIS, the Global Influenza Surveillance and Response Network, is absolutely critical. It's made up of more than 150 labs in 130 countries that are tracking influenza viruses, seasonal influenza viruses, zoonotic influenza viruses from all over the world. And every 6 months, they come together to evaluate what is in circulation, and they make recommendations on vaccine composition for the influenza vaccine for seasonal. They also identify viruses, candidate vaccine viruses that could be used by manufacturers for a potential pandemic. So this is getting ready if there were to be a pandemic with a zoonotic virus. So we have resumed the circulation of these samples. WHO has some funding, mainly to support low-income, middle-income countries to ship those viruses around. And what normally is happening is that a country will identify or have some samples. A national influenza center will do some analysis, and some of those samples are shipped to WHO collaborating centers. We have 7 of those for influenza. One of those is in the US, but we have them in the UK, we have them in Australia, we have 7 around the world. And as you said, the vaccine composition meeting will be taking place later this month. The US will participate in that meeting, as far as I understand, but it's a really important meeting, and it's made up of incredible expertise and scientists from around the world. That's the benefit of GISRIS. It's not any one institution, it's not any one country that's contributing more or less. It's actually the coming together. And this group meets regularly. It's not just every 6 months, they're meeting regularly to assess what's happening around the world. So yes, the meeting will take place at the end of this month. And yes, the US is participating.
Thank you very much, Dr. Van Kerkhove. I understand Helen Bransfeld has a follow-up. Helen, please go ahead.
Hi, thank you very much for coming back to me, Tarek. I wanted to swing back to Dr. O'Brien's response to my earlier question. She said there is support to the ministry. Does that mean WHO has been dealing with the ministry to discuss the study and potential concerns about the study? And she also said there was some issue about if it has been designed in a way that can even answer questions. I guess I would like to hear her thoughts about whether the protocol that was released publicly is likely to add anything useful to the body of knowledge about the value of hepatitis B birth dose. Thank you.
Dr. O'Brien.
Thanks, Helen, for the follow-up question. So as you know, WHO has country offices in countries around the world, and the country office in Guinea-Bissau is in regular contact with technical counterparts in the ministry. So there is engagement between WHO and the technical program on immunization. And what is most important here is that the ministry, as I mentioned before, it's really a country that must decide what kinds of research they want to participate in, they want to lead in. And so this is really a decision of the country about how they want to go forward with a study that has been proposed to be conducted in their country. And to really understand the scale and scope of what the issues are, there are technical research issues, there are ethics issues, but first and foremost, the issue is the research that is proposed to be done relevant to the country, relevant to the priorities of the country, relevant to the policy issues of the country, and in particular, relevant to the, in this case, the vaccine decisions that the country has already made. So it's understood that the country has made a decision to go ahead and introduce hepatitis B birth dose vaccine, and is when exactly that process of introduction will take place has to be understood fully within the capacity of the all of the different things that the immunization program is aiming to do to improve its program. So you asked about the design of the study and whether or not this will answer important questions. I think you've asked some very technical questions. So I want to say first and foremost, hepatitis B birth dose is a vaccine that has been used for over 40 years. There are dozens and dozens of countries around the world. In fact, over 150 countries use hepatitis B birth dose. We have a very strong experience with hepatitis B. It's a safe and it's an extremely effective vaccine. Whenever we do research, whenever research is proposed, there has to be some foundation for proposing research, especially when it is asking a question about an authorized vaccine, a vaccine that has a very long-standing safety profile. So there has to be some basis for expecting that there is an issue or a question that needs to be asked. And to our knowledge, there is no underpinning evidence that would suggest that there is any concern with respect to hepatitis B vaccine. The second thing is that the questions that are being asked have to be policy relevant, but most importantly, the conduct of research must first and foremost protect the interests of the participants that are being approached to be involved in what we refer to as human subjects research. And there is the Declaration of Helsinki, which lays out the agreed upon standards that any human subjects research needs to meet those standards. There are some very concerning aspects of the study that have been proposed, and these are some of the questions that we were asking of the investigators when we had a very good opportunity to discuss with them. So it's really up to the ministry to decide whether or not the questions that are being asked within this research study are relevant to the country, relevant to the vaccine decisions that the country has made already to go ahead and actually introduce a vaccine that is a globally recommended vaccine. It's an authorized vaccine. And those are important attributes because that means that this vaccine has had a full and extensive review and an ongoing review of its performance and its safety profile. And I want to remind us all that the reason for giving hepatitis B vaccine is that hepatitis B transmission from mothers to infants is an extremely serious and life-threatening condition for those infants. 90% of children who are born to a mother who is surface antigen positive will be infected with hepatitis B, and about a quarter or more of those children will go on to have very serious consequences of that infection, and it's the leading cause of transmission of hepatitis B. So giving a birth dose, which we do recommend that countries have in their program, is extremely important. So I hope that addresses some of the questions that you have on the issues around the study design and the likelihood of adding to the body of knowledge. Thanks.
Thank you very much, Dr. Bryan. And with this, we come to the end of today's WHO press briefing on global health issues. As always, we will send you audio and video file of this briefing shortly. And if you have any further questions, don't hesitate to send us a message to media@who.int. I give the floor to Dr. Tedros for his closing remarks.
Yeah, thank you. Maybe earlier about the MOU, I thought that would suffice it, but maybe I can add a few points. By the way, bilateral agreements between countries is not a new phenomenon. There are many countries who have bilateral agreements on health. It has been there for a long time, so it's not new. But some of the concerns that are coming from some quarters is that these bilateral agreements may replace the multilateral system. I don't think so, because it has been there in the past, it hasn't replaced, and I don't see how it can replace it now. So maybe that's the question. But any member state can have any MOU with any country it wants, and this is between sovereign countries. And they know best for their respective countries. Actually, they will do it in the best interest of their nations, in their best national interest. So we'll leave it at that. Maybe something more specific to that is, as you know, there is PABS negotiation now happening as part of the pandemic agreement, and there are some people who ask questions saying, will it really undermine that? I don't think so. It doesn't undermine, because the same answer, bilateral agreements have been there, and still with the new agreements that we see, I don't see there will be any impact on the PABS negotiation that's happening. So if these are the concerns, we're not really worried about those issues that are raised. and there can be bilateral agreements, and there can be also multilateral agreements, and it's not one or the other. Both can exist without any problem. Then on the hepatitis B study, as you know, Guinea-Bissau is one of the countries with high prevalence of hepatitis B, and withholding a birth dose could actually expose, as Kate said, expose infants to a high chance of infection. And that means including a significant proportion of deaths. And also, this violates, by the way, the basic protocol. While you have an effective medicine, denying half of the population of the children access to already a vaccine that has been there for more than 40 years, which is safe and effective, is not ethical. I think it's better to give it its name. The country can decide. Of course, a sovereign country can decide whatever they want. But as far as WHO's position is concerned, it's unethical to proceed with this study. And it's very clear, and this will expose these kids, half of the 14,000, I think it's 14,000, the size of the sample size, and denying half of them to an existing safe and effective vaccine is unethical. And from WHO side, the position is very clear, but the country can proceed knowing full well that it's unethical. And the scientists can proceed knowing full well that it's unethical. That's what I would like to say. Maybe it's better to say it bluntly and straight. And to that effect, we would like to issue a statement on this as WHO, because this is very important. It's not about one country. And such studies could affect other countries as well. So we're preparing also and to issue a statement with this regard. Thank you. So I think I didn't say the one word I say always. Thank you to all members of the press for joining us today, and see you next time.